Hello.
Hi.
How are you today?
Good, how are you?
I'm good. I'm just going to ask you to tell me your name and date of birth, please.
Courtney Del Greco, 22894.
Perfect. That's what corresponds with your wristband. Do you know where you are today?
Colby-Sawyer,
And can you tell me the day?
April 22nd, 2014.
Perfect. So that means you're oriented times 4. So today I'm going to perform a physical assessment. Is that okay with you?
Yep.
Okay, perfect. I'm going to start with your vital signs.
Okay.
Starting with your temperature. Can you lift your tongue to me, please? (98.0 degrees Fahrenheit). So perfect. I'm now going to test your SpO2. (100%). Perfect.
Good.
I'm just going to check for your radial pulse. I'm just going to take your elastic off. Alrighty, so your respirations were 18.
Okay.
Rate was normal. Rhythm was normal as well. And your pulse was 68,
Okay.
which is also normal. Or your heart rate, excuse me. Now I'm going to check your blood pressure. Okay. I'm going to blow it up first until I can't feel your pulse anymore.
Okay.
Your blood pressure was 110/68. So perfect, within normal limits. Okay, I'm now going to have you close your eyes. I'm going to ask you to smell something.
Okay.
Can you tell me what you smell?
Coughing?
Yep, that was testing cranial nerve number 1. Can you read the sign across the room, please?
Always wash your hands.
Perfect, so that was testing cranial nerve number 2.
Okay.
Testing cranial nerve 3, 4, and 6, I'm going to have you follow my fingers for me. Perfect. So your eyes are able to follow the direction of my fingers. Now can you touch your finger to your nose and then to my finger? Perfect. I'm now going to check your pupils to see if they equally constrict. So if you can look at my forehead for me, they're at about a 5 right now. I'm just going to flash a light in them real quick.
Okay.
Alright, so they equally constricted on both sides.
Okay.
I'm now going to test cranial nerve number 5. Can you clench your jaw for me? Perfect. So that was equal on both sides. Can you close your eyes for me? Am I touching you?
Yep.
How about now?
Yep.
Now?
Yep.
How about now?
Nope.
Okay, perfect. Now testing cranial nerve number 7. Can you puff out your cheeks? Can you smile? Can you frown? And can you lift your eyebrows? Perfect. Testing cranial nerve number 8. Can you hear this?
Yep.
What about this?
Yep.
Perfect. Testing cranial nerve 9, 10, and 12. Can you stick out your tongue for me? And can you open and say ah? Awesome. And can you swallow for me? Any difficulty?
Nope.
Perfect. So your uvula was lifted and your tongue was midline.
Okay.
And then testing cranial nerve number 11, can you shrug your shoulders? And can you turn your head both directions for me? No resistance?
Nope.
Awesome. Okay. Now can I have your hand from you? Can you close your eyes for me?
Mm-hmm.
What did I draw on your hand?
A 6.
Perfect. Keeping your eyes closed, I'm going to hand you an object. And can you tell me what this object is?
A cotton ball.
Yeah. Okay. I'm now going to do a 2-point method.
Okay.
So I'm going to put 2 points on you. Have you close your eyes. And you
Okay.
tell me when you feel like there's 1 on you.
Okay.
So there's 2 on you right now.
Okay. 1.
Perfect. So about half a centimeter.
Okay.
And now I'm going to put a dull and sharp pain on you, and I want you to close your eyes again, and I'll put 1 on you, and you're going to tell me what type of pain stimulus you feel.
Okay.
So if you can close your eyes, this is sharp,
Okay.
and this is dull.
Okay.
Can you tell me what this is?
Sharp. Dull. Sharp.
I'm just going to lift the blanket down a little.
Dull.
Yep.
Sharp. Sharp.
Yep.
Dull.
Yep.
Dull. Sharp.
Perfect. So you were able to identify the different pain stimulus. Alrighty. So now I'm just going to check your hair,
Okay.
looking for any signs of lesions, bleeding, bruising, any lumps or masses, which there is none. Your hair is well hydrated and there's no signs of alopecia.
Okay.
I'm just going to check your ears. Any tenderness when I do this?
Nope.
Perfect. There's no sign of skin breakdown. She does have piercings. How about any tenderness with this?
Nope.
Perfect. And no sign of skin breakdown. I'm just going to have you tilt your head back for me so I can look at your neck. So trachea is midline. Can you tilt your head this way for me? Perfect. So there's no jugular distension. I'm just going to feel for your carotid. Present at 2+. And feeling again on this side. Present at 2+ as well. And there's also no jugular distension here. I'm just going to listen with my diaphragm and my bell. Starting with my diaphragm. And switching to my bell. And can you turn the other way for me? Thank you. And now my diaphragm. Perfect. Rate and rhythm sounded normal.
Okay.
So eyes, ears, mouth, nose, neck are all with normal limits. So I'm just going to check your arms now. Looking for any edema, ecchymosis, bruising, or bleeding. None of that is present. Any tenderness?
Nope.
Perfect. No sign of pressure also on the elbow. I'm just going to come down to your hand, test for turgor. No tenting or loose skin, which is good, and capillary refill 3 seconds or less.
Okay.
So your skin is warm, well hydrated, no sign of diaphoretic. Looking at this arm as well for the same thing, ecchymosis, edema, bleeding or lesions, which there appear to be none. No sign of pressure ulcer on that elbow either. Capillary refill, 3 seconds or less. So I'm just going to check for your brachial. Which is 2+, and now moving down to your radial. Take your elastic off. And then to your ulnar. Both of those were 2+ as well.
Okay.
Moving to this brachial. Two plus, moving down to your radial, and then to your ulnar. Those are also 2+. So that's good.
Okay.
I'm just going to test your range of motion on your arms.
Okay.
Can you lift them above your head for me? And to your side? And down to your waist? Awesome. Can you wiggle your fingers? Can you twirl your wrist? Can you touch your fingers to your thumb? Awesome. Can you do fast moving motions on your legs? Perfect. Alrighty, so your range of motion was active, and I'm now testing your muscle tone. Can you squeeze my fingers for me? Okay, can you push on me? And can you pull? So your muscle tone is rated as a 5.
Okay.
Equal on both sides. I'm now going to listen to or inspect your chest. I'm going to do a lung examination and then move to your pulses, or heart sounds, excuse me. So inspecting, there's no sign of bruising or lesions or bleeding. Now I'm going to palpate. Any tenderness when I do that?
Nope.
Once again, feeling for masses, feeling for tenderness, and she reported none. So I'm just going to percuss now. I'm going to stick my finger in between your intercostal space. Okay, so on the anterior chest wall, we were able to hear resonance.
Okay.
I'm just going to listen to your interior chest, and I'm going to have you inhale and exhale out of your mouth for me.
Okay.
So move down to your lower. Okay, lung sounds were clear and symmetrical on both sides. I'm now just going to listen to your heart sounds, if that's okay.
Yep.
I just have a few locations to look at.
Okay.
Starting with your aortic area, which is on your right sternal border and your second intercostal space down. Now moving to your pulmonic area, which is on the left sternal border, but also the second intercostal space down. Moving to Erb's point, which is also on the left sternal border, but it's the third intercostal space down. Moving to the tricuspid area, which is also on the left sternal border, fifth intercostal space down. Sorry.
It's okay.
And then moving to the mitral area, which is the fifth intercostal space as well, but the mid-clavicular line. Perfect. And while I'm down here, I'm just going to listen to your apical pulse and feel your radial at the same time to make sure your S1 and S2 is evident. your wristband off real quick. Perfect. So rate and rhythm were normal. Now I was able to hear your house sounds in all 6 of those points.
Okay.
Okay, so I'm now going to lay you down if that's okay so I can assess your abdomen.
Yep.
Okay, just gonna pull the blanket down a little. Pull this up. So inspecting first, her umbilicus is midline, her abdomen is symmetrical. I'm gonna get eye level to see the contour of her stomach, which is flat, and look for any palpitations or pulsing in the abdomen. Alright, I'm now gonna auscultate to listen to your abdominal noises.
Okay.
Starting in the right lower quadrant. Moving up to the right upper quadrant. Now shifting over to the left upper quadrant. And now moving down to the left lower quadrant. Perfect. So your stomach noises were active, high-pitched and irregular, which is normal.
Okay.
I'm now just going to percuss. Alrighty, so timpani was heard all over.
Okay.
A little duller on the top, which is normal. I'm now just going to lightly palpate. Tell me if there's any tenderness.
Okay.
I'm looking for lumps or masses and to observe to see if she has any guarding, which she doesn't. Are you feeling any pain?
Nope.
Perfect. Now I'm just going to deeply palpate and once again tell me if you have any tenderness.
Okay.
Any?
Nope.
Perfect. Now I'm just going to release quickly and tell me if you have any pain when I release.
Okay. Nope. 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 Nope.
So no sign of rebound tenderness, which is normal. I'm just going to sit you up now if that's okay.
Yep.
Just let me know when you're comfortable.
That's good.
Okay, perfect. So I'm just going to examine your legs now.
Okay.
Reveal your feet.
Okay.
So I'm going to check your skin again as well.
Okay.
Feeling for temperature, which is warm. No discoloration, so skin color is normal.
Okay.
No signs of bleeding, bruising, no swelling noticeable. Feeling around. Any tenderness?
Nope.
Perfect. Okay, so while I'm up here, I'm going to feel for your popliteal. Popliteal is normally hard to feel, so it might not be palpable.
Okay.
Try to feel for this one. Unable to feel that one as well,
Okay.
which is not unnormal.
Okay.
I'm feeling and looking around this leg as well. Any tenderness on this leg?
Nope.
Okay, there's also no signs of ecchymosis, edema, bleeding, or lesions. Coming down to your feet, I'm going to feel your pulse. So 2+ on both feet, which is normal.
Okay.
I'm just going to test your capillary refill. Your feetsies are a little cold. Capillary leaf fill was a little slow, but do your feet feel cold?
Yeah.
Okay. I'm just gonna check your heels. There's no sign of skin breakdown. Bilaterally, so perfect. I'm just gonna test your range of motion on your legs. So
Okay.
can you lift this leg for me?
Yep.
Can you move it out?
Yep.
Can you bend your knee?
Yep.
Perfect. And up again. And out. And in. Awesome. Can you push on my hands? And how about pull? Awesome. Can you rotate your ankles? Can you wiggle your toes? Any tenderness or pain with that?
Nope.
Awesome. Any resistance with any of the movements?
Nope.
Perfect. So your range of motion was active and your
Okay.
muscle tone was 5.
Okay.
Can I have you put your heel to your shin? And on the other leg. Awesome. Perfect. Now, can I have you, if it's okay, have you sit up on the edge of the bed so I can listen to your lung sounds in the back? Okay. So looking at her back, skin color is normal. Skin is well hydrated. It is warm. No signs of being diaphoretic. Her back is symmetrical. Can you inhale in and out of your mouth, please? Okay, so lung expansion was also symmetrical. So I'm just going to palpate now to feel for any tenderness, any lumps or masses. Do you have any tenderness while I'm palpating around? Okay. So now I'm just going to percuss again. Sticking my finger in between your intercostal space. Okay, so resonance was heard all over the chest wall. I'm now just going to take a listen.
Okay.
So if you could, please inhale and exhale out of your mouth. If you get tired at any point, please let me know.
Okay.
And can you start? Couple more. And more. Perfect. So all sounds were clear
Okay.
across the chest wall posteriorly.
Okay.
And I'm just going to feel for vibration. So I'm going to ask you to either say blue moon or 99. You pick.
Okay.
So starting now, go ahead.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
So vibration was felt all over the posterior wall, which is normal as well. So now I'm just going to check for kidney tenderness. I'm going to indirectly punch your back, and if you have any tenderness, please let me know.
Okay. Nope. Nope.
Perfect. I'm going to come around to the front of you and just check your range of motion on your knees.
Okay.
Can you lift your leg up? And how about on this one? Perfect. Any tenderness?
Nope.
Any pain?
Nope.
Awesome. All right, so you can crawl back into bed. Would you like to be covered?
Sure.
All right, so I've all done my physical assessment. If you need
Okay.
anything, the call aid is in reach, and just let me know.
Okay, thank you.
Thank you.